Hi, my name is Cassidy Freeman and I'm going to be demonstrating how to clean a wound. First, I would knock on the patient's door, provide privacy, wash my hands, and then I would check the patient's armband to verify that it's actually them. And then I would explain the procedure to the patient, and then I would have a biohazard bag set up right there. And then I will get my sterile field ready. So first I'm going to open up the gauze. Careful not to touch the actual gauze itself. And normally this would be. And then I would open this one. Careful not to touch anything. Okay. And now I'm actually going to move over here. Cover it up a little bit. And I'm going to gently remove the pad, and I would have clean gloves on while doing this. And then I would check the pad for any discharge or like blood or anything like that and throw that away. And I would remove this gauze, again checking for any blood or discharge or anything like that. And with that same pair of gloves on, I will take out the dressing, careful not to touch the wound itself. I'd also be checking the amount of blood and everything. Then I would actually take off my gloves, wash my hands, put on new gloves, and then I would assess the wound. And it has a pink border. There's no odor or like drainage or anything like that. It looks like it's healing very nicely. And so then I would wash my hands again, and then I would come back to my sterile field and get that ready. And before I put my gloves on, I'm going to open my cotton-tipped Q-tips and put them on here without touching them. Oh, come on. There we go. And now I'm going to grab my saline and protect the label and dump it into my gauze. Okay. Now I'm going to put my sterile gloves on. Okay. Now I'm going to take one piece of gauze, and I'm actually going to clean the wound, going on the outside and down from most contaminated to least contaminated. And on this side. And then once in the actual wound. And now I'm going to take another piece of gauze and get out all the excess fluid. I'm going to grab my cotton-tipped Q-tip and making sure that the cotton tip is facing the wound so then I don't break off a piece of wood into the wound. I'm going to take my gauze and pack it into the wound. and I don't want the gauze to touch the outside of the healthy tissue, because that would cause breakdown. I also, since I'm wearing sterile gloves, I want to be careful not to touch the patient's skin. I'm going to grab one more piece of gauze. While doing this, you don't want it to be overflowing, but you want it to be flush. Oh, okay, well that's dangerous. Grab my other Q-tip right here. Alrighty, now that that's all packed, I'm going to throw these away and grab some dry gauze and just place it over the top, like so. And grab my abdominal pad and place it over, and then I would use a couple pieces of tape to securely place it so the patient's comfortable. And then I would ask the patient how she's doing and make sure that she's comfortable, make sure the call light is within reach, and lower the bed. And then I would clean up after myself, and that is how you clean a wound.